Hello, my dear friends. In today's video, we're going to talk about how oral health impacts whole your body. My name is Dr. Dmitry Gorbatov. I'm practicing holistic and cosmetic dentistry for more than 34 years, right here in Hollywood, State, Florida, right on South Ocean Drive. How dental health, how oral health impact your whole body? We can start, of course, with the condition which people have, and we're now aware that those conditions are really can influence your whole body. First of all, it's periodontal disease. If you are diagnosed with a periodontal disease, there is a lot of bacteria involved, there is a lot of infection. The periodontal disease and the bacteria which is caused directly related to the heart and heart vessels. So basically those bacteria cause endocarditis, was inflammation of the heart vessels. We plug them out. So very bad idea to have a periodontal disease, a heart problems at the same time. Another thing, which is root canals, failing root canals, or some of the root canals which is done with certain materials which can highly allergic. So people with those restorations can experience some skin problems, some allergic reactions, some headaches. And they would never be related to the existing root canals, but that's what it is. Failing root canals and allergic reaction to the root canals can cause those problems. It could be even some skin problems, some eczemas on the skin could be related to this. Another things you should take in consideration when you have old crowns. If you have a PFM crowns, we got the metal frame and ceramic outside, those crowns only last about 10 years. The problem is that the crowns will last, but the cement we use to cement those crowns get washed away. So it creates spaces underneath of the crowns and bacteria goes up there, and this is a beautiful home for them. It's wet and it's warm. They live there. They live there and create a lot of problems, a lot of bacterial infections underneath. If you see your gums are receding out of your crowns, that's what's happening. So it's time to change those crowns. When we remove those crowns, we do detoxification because we're removing any metals out of your mouth. It's not healthy to have it. You're going to see underneath of the crowns mold. It's really green, black to green. It's the same mold we have in the toilet. It's exactly the same thing. They're living there, they love it. So these bacteria can cause some really allergic reactions in your body, can cause some skin problems, can cause some bad breath, of course, because of that food impaction underneath of the crown. So those crowns has to be changed and done properly. We don't use the PFM crowns, we use only full ceramic restorations. Another thing I should mention to you is a surgical extraction. The surgical extraction should be done proper way. If the surgical extraction is not done proper way and all the ligaments where the tooth is not removed or cyst infection left inside after the tooth was inflamed for some time, this could cause some infection left inside of the bone after the extraction. And those bacteria can live there. Some of them are aerobic. They could cause some of the chronic infection inside of the bone. So in the cases like this, make sure that you got surgical extractions, they done properly with the right trained specialist or holistic dentist, which is properly remove the whole thing, use some ozone treatment to make sure that all the infection, all the pathological tissue is physically removed, and then the defect is filled with the bone graft or biological material, not left open like this for 2 months of healing. It's not right. Another thing I would mention, which is rarely people relate, which is bite. If your bite is improper, or your bite is unstable, or some work was done and your bite get changed, you got some shifting on your jaw, you're basically preferring to eat on one side versus another, and your bite slightly will change. It could get shifted. The position of your lower jaw and your upper jaw influence your spine. So it means that if your bite is off, your spine start to get disalignment. So there's people coming with us, they got some really severe bite problems, and they're complaining about their spines. It could be pain on the upper back, lower back, or middle back. Everybody is different, but we see all those cases. These cases has to be taken into consideration, and the bite have to be corrected. There is different ways of correcting bite. It could be temporary correction, it could be permanent correction with the ceramic restorations. But once the bite is corrected, the spine automatically goes back. It's a miracle. Nobody think about it, nobody really knows about it, but that's the way it is. So if you have any back pains, you have some problem with your spine, you should change you should check what's the condition of your bite. And it's easy to check. It takes 5 minutes, that test, to see if your bite is correct or not. And the last things I would mention is, of course, mercury fillings, which is amalgams. They definitely should be removed because mercury is one of the most highly potential poison, which can cause a lot of different problems, including overloading of the immune system, overloading of your nerves, because mercury accumulates in your nerves. It could be some numbness of your hands and legs. It could be some tingling in your hands and legs. It could be some headaches. It could be some even depression signs. It could be attention deficiency of attention. So it could be a lot of neurological problems, even including skin problems too, and often headaches. So if you have any of those symptoms, right, and if you have any of those general problems, please make sure that your oral health is in a good condition, because if the real cause of those problems is your oral health, you should take care of this and get rid of those problems. If you have any of those conditions, or you think that it could be related, some of your general problems could be related to your oral health, please contact us. Come for the examination. We'll take a look at you. We'll do our tests, and we'll see what's going on. And we're glad to help you out to have better general health and live a wonderful life. Thank you very much, and have a nice day. Thank you for attention.